Good evening, everybody. Thank you so much for joining me tonight on YouTube Live. I'm Dr. Howard Elkin, the medical advocate, and being June, this we're going to celebrate Men's Health Month. Men's Health Month was developed. I looked it up. It was developed back in 1992. That's 21 years, 31 years ago, and so it's not a new thing. And it was developed to develop awareness in men with men's health problems, and also to encourage early detection and treatment with men. And there's no secret that men live on the average like 7 years less than women. And maybe we'll discover tonight why that is so. But I think the movement was a good one 30 some years ago because it was to increase awareness of men's health issues. And it's really important. So we're very fortunate in having this designated time every year to celebrate Men's Health Month. And as you know, last month we celebrated Women's Health Month, which was in May. So this one's devoted to the fellows out there. And so let's go over some. I always like to start with some statistics for shock value, but more than 400,000 men die from heart disease every year. So heart disease is still the number one killer in both men and women. But with one every four deaths is related to heart disease. But more than 700,000 men develop cancer each year. Now, most of those cancers are not necessarily fatal, but really about 300,000 of those cases will end up in death. So we got 400,000 men dying every year of heart disease. We have 300,000 men dying yearly of cancer. Now, the most common cancer in men really is prostate cancer. However, the most deadly cancers, it's always heart, it's lung disease first, lung cancer, then prostate cancer, and then colorectal cancer. Those are the three most commonly causes of death in men when it comes to cancer. But what about other effects? Mental health, for example. You don't hear much about mental health in men, but it's really important because basically men that are inactive have a 60% more likely, 60% chance to develop depression during their lifetime. That's 60%. It's no small figure. So even if you hate to exercise, guys, there's two reasons why you have to do it. Forget the benefits of exercise itself. Number one, it increases blood flow to the brain, which is very important for cognitive function as we age. And number two, is what I just mentioned before. It's a great way to avert depression as we get older. So being active is really an important thing that is oftentimes ignored in men. Now, the other one is sleep. So there's activity and then sleep. So it's been shown that men who sleep 7 to 8 hours per night, and that seems to be the ideal number, 7 to 8 hours per night, have about a 60% less chance of developing a heart attack. So that's pretty 60% less of a chance. So important stuff, right? Now, how are we doing with all these years of celebrating Men's Health Month? Like I said, 31 years. How are we doing? Well, not so great. I mean, men are still less likely to seek medical care when compared to women. Women go to the doctor twice as often as men. So women really are the purveyors of healthcare in this country. Now, I like to think that things are changing. I mean, when I started my practice 36 years ago, and being a cardiologist, when I would be on call, usually the men would be in the ambulance with chest pain before they actually would call for help. I'm being a little cynical here, but seriously, it was right to the very last minute. In fact, 40% of men delay treatment even when they're sick. And mental health is probably one of the most stigmatized issues affecting male men, and greater than 30% of men suffer from depression. So it's not insignificant. Now, women are more likely to attempt suicide, but men are more successful at it. So it's not a good thing. Depression is always very serious, and in men, it's oftentimes ignored. Men don't talk about it. Heart disease, again, we've already mentioned, is the most common cause of death in men. Coronary artery disease is the most common player here. And it really, a heart attack can strike a man at any age. The average age for a heart attack is 65. Okay, but up to 10% of heart attacks are in people under the age of 45. So it's not just about a disease of the elderly. And the bad news is that, or discouraging news, is that heart attacks are increasing in number now in younger people because of obesity, inactivity, poor diet, etc. So we're not looking at a healthy environment right now. It's pretty serious. So the important thing is to know your numbers, know your blood pressure, know your lipids, and get checked out early, and always be on the front line. Be ahead of the eight ball, not behind it. And that's what I preach in my practice, being the medical advocate. And I'm serious about that. That's the heart. And of course, that's what I'm most well known for. But let's talk about prostate health. Now, prostate cancer is disease of the elderly. We think that it usually increases with age, but 60% of men will develop a form of prostate cancer over the age of 65 or so. So it's very common. Now, what about screening? It used to be you should check your PSA, prosthetic specific antigen, at age 50. And I don't wait to 50. I do it much early. I do it maybe 40, maybe late 30s, depending on the individual. But usually what's recommended by the American Cancer Society is he's age 50. However, that's also changed. If you are a male who's at high risk for developing prostate cancer, such as if you have a first degree relative that's had prostate cancer, and that means a parent, a sibling, or a child, then you need to get checked early, like 45. And if you're even higher, and I also mentioned African American, and it's really changed with this. I'm sorry. We'll go into that in a minute. African Americans are necessarily more likely to develop prostate cancer, but they tend to develop a more aggressive course, which is why we have to really be very careful with that population. So, and I would even screen at age 40 for higher risk people that are, sorry, if you're African American and have two first degree relatives. So those are the recommendations: age 50, 45, or 40. I tend to do it 40 or less in my population of patients. And how often should you check this? At least annually. At least annually. What about prevention of prostate cancer? Or what about prostate health in general? Well, it's basically it's going to be the same thing for heart disease and cancer prevention. We like colorful vegetables, and actually, colorful meaning red is very good. Like watermelon, tomatoes are very high in lycopene, which is very helpful in prostate health. Low in sugar is the main thing, and low in processed meats. Fruits and veggies are always very good. Healthy fats, smoking cessation, fish oil, and exercise. Now, colon cancer is another biggie. Like I said, it's the third most common cancer in men, but it's a very high mortality rate if you don't catch it in time, which is why screening is so important. Um, and I think this all came to attention with the Broadway star Guzman, who died a few years ago at age 37 or 38 of metastatic colon cancer. So it really kind of changed things a lot, and it made us really we lowered our standards. Okay, or maybe we should say we increased our standards. It used to be that if you were 50, you would have your first colonoscopy. Now it's like age 45. But if you're African American, or if you have, again, first degree relatives with it, you probably would check at age 40. So 40, 45, 50 is no longer what we use. How do you prevent it? Well, here's one thing I didn't really know is that long-term use of non-steroidal inflammatory medications such as Motrin, Aleve, um, ibuprofen, Advil, they actually can be a risk for colon cancer. Also, low intake of fruits and vegetables, processed meats, obesity, SAD, the standard American diet. These are all things that can affect your chance of contracting colon cancer, and of course, genetics. Prevention is the same thing we talked about with prostate. It's fruits, vegetables, alcohol cessation, smoking cessation, low sugar, ideal body weight. It's all about diet and lifestyle. And I mentioned about the screening has changed. So what you might not know, and this is important information about men, is that the sperm counts are dwindling significantly over the last 50 years. We're talking 50% decrease in sperm counts over what it was 50 years ago. Now, is that a big deal? I think it's a big deal because we know that reproductive ability kind of keeps the race going. And all of a sudden, we're seeing a decrease in reproduction, which can definitely be a result of low sperm counts. That this is not going to do well for the health of men. So We don't have all the facts and figures. We don't know whether this is an exaggerated figure or not, but there's no question about it that sperm counts are decreasing. We see it all the time. And that will, of course, lead to decreased fertility on the part of men. What are the causes we think? Well, obesity. I don't have to tell you that we have a real fat problem in this country. So 42% of people are obese, 75% or nearly 75% are overweight, and also environmental sad standard American diet. People are eating crap these days. They're eating garbage. So the diet is major, and other things, environmental toxins, pesticides, bisphenol A, BPA. I talk about that all the time. That's seen in the plastic industry. It's just destroying our environment, and it's plastics in everything. I didn't even know that the interior of cans. Not that I ate canned foods, but the interior of they're lined with PBA. I didn't know that. It's terrible. So what else about that? So we know about sperm counts are dropping. The other thing is testosterone levels are falling. And they've studied men from 1999 to 2016. So testosterone levels are falling, especially in adolescent men and young adult men. And in their 20s, like I never heard about this before. So why is that happening? Again, overweight population, standard American diet, lack of exercise. People are doing their video games all day long, and poor sleep. Sleep definitely has an effect on that. What about erectile function? Okay, that could be a sign. Erectile function can be a result of either physical or psychological condition. And it's really important to figure out what that is before we rush to that blue pill, right? Everybody's going for that blue pill, but we need to know, is this physical? Is it psychological? Living in a very stressful world that we are now, there's enough reasons why we could be psychologically stressed that getting it up is not so easy anymore. Working long hours, not enough sleep, drinking too much, smoking. These all affect our ability to have an erection. So it's very common. More than 30 million men in this country have ED. We also have to consider things like physical causes, like, for example, hardening of the arteries, right? Well, the arteries of the penis are just like all the other arteries in the body. So developing plaque in those arteries can adversely affect your ability to have an erection. In fact, there's a very strong link between erectile function and heart disease. And it's thought in some circles that people with ED is a risk factor as much as smoking cigarettes or having a family history of coronary disease. I mean, can you imagine that? So I get a lot of referrals from urologists about men with ED, and they want me to rule out a cardiac-related problem. I mean, I get several because the association is real. So what do you do for erectile function? First of all, sugar is the worst. Sugar is absolutely worse. In fact, there was a study in 2013 that demonstrated that men up to the age of 75 who ate 75 grams of sugar, which is a hell of a lot of sugar, dropped their testosterone levels by over 25% over the next 2 hours. I don't know how this study was conducted, but can you imagine? You drop your levels by 25% over a 2-hour period just by eating a huge degree of sugar. I don't know how much sugar people have at one setting, but the association is pretty severe. So that's what's to avoid. What would be worthwhile is things like watermelon. I mentioned watermelon before because of the lycopene, but also a citrulline in it, which is a precursor to nitric oxide, which helps to dilate vessels. Okay, spinach, leafy greens, salmon, pistachios, oranges, blueberries. Everything good about blueberries these days. So there's a lot of foods that can help in that regard. What about supplements? So there's this thing called Tribulus terraceus is a small leafy plant. I've never seen it work, at least in men. I've seen it work in animals, so I'm not too impressed with it. Maca, red ginseng, these are supplements that you use to help with. But I think it's very important to maintain erectile function is zinc. Inexpensive zinc is a mineral, and I suggest at least 50 milligrams a day. And of course, the drugs work. You all know about Viagra and Cialis. They enhance the effects of nitric oxide. That's really your bottom line. So that's that. Now let's talk about testosterone therapy and what we can do about it. First of all, someone comes in with symptoms, you need to actually look at the levels. So a normal level is anywhere from 250 to 1,000. 250 to 1,000, right? It's a huge span. Why? How's that so? Well, usually when you're a male of about 25, which is when these levels peak, your level's about 1,000 or 1,200. Okay, that's the peak. From that point on, it starts to drop. And by the time you're 60, 65, it's probably going to be 200, close, less than 300. So that's basically the cutoff is 250 to 100. Um, we don't recommend treatment people that are not symptomatic. Well, a lot of people, I mean, I necessarily think I'm pro aging. So, I mean, pro aging, I'm proactive when it comes to aging. I'm not so much anti-aging. I'm anti getting old, and I think supplements, I think testosterone does have its role as estrogen in women. But usually, if you look at most studies, only study men that are symptomatic. So, how do you know that you have low testosterone? Well, basically, the cues are less sex drive, libido, erectile function, body composition changes, a bigger fat to muscle ratio, less strength, less if less progress in the gym. You're working harder, but you're getting anywhere. Depression, motivation, and initiative, all that goes downhill. Basically, the grumpy old man syndrome, which you want to avoid. Now, administering, there's gels and there's also injections. And as far as I'm concerned, they both work because the parent compound is testosterone. A lot of people like the gels because they get this even keel kind of measurement throughout the week. I have found them both and I've been cardiology for 36, 37 years, and I've been doing anti-aging for 23. So I have a lot of experience with testosterone replacement therapy. And basically, it's they both work. They both work great. Now, what are the pitfalls? What can really screw up your testosterone levels? Number one, it's EMFs. It's the worst. So carrying your phone with you, it's detrimental to our sexual health and to the health of our testosterone levels. So EMFs are a big, serious problem these days. They can mess up with our gonadal function and both fetal development and pregnancy as well. And sugar is a big one as well. Other things to avoid are vegetable oils, which are pro-oxidants. I don't believe in vegetable oils, processed foods, and alcohol. Those all can adversely affect your testosterone levels. Now, what about nuts? It's very interesting because we think nuts are really healthy, and they can be. However, walnuts and almonds, which are very heart healthy, can increase levels of something called the sex hormone binding globulin, which binds to testosterone and makes it less active. I don't know. It's never bothered me, but I think that's been studied. And Brazil nuts are probably the healthiest because they increase your selenium levels naturally. Sleep is really important. And studies have shown that testosterone levels can decrease by 10 to 15% after a week of sleep deprivation. And that was a study we've known since 2011, which we weren't even talking about sleep back in 2011. It's very interesting. Are there any things that we can do to help our testosterone levels? Yeah, one is zinc. Zinc is inexpensive. It can possibly help. One is also some acetyl L-carnitine, which is one of the few carnitines that can actually pass the blood-brain barrier. So it can help with depression and attitude, and may also help with sexual function. There are studies. Actually, these studies were conducted in Italy by Dr. Cavallini a few years ago, in the last 10 years. And it's very useful. It's been shown to improve sperm motility and testosterone levels. But you need a large dose. Like I take acetyl-carnitine, but I don't take 2 grams a day, which is they recommend for sexual function. But it's something to consider. We already talked about zinc and adequate hydration and activity. All these things are important. Exercise will help boost your testosterone production. But let's face it, guys, when the levels get really low as we age, school's out. Then you have to consider replacement therapy if That's a personal decision, and that's where you need to go to a doctor who really knows about testosterone replacement therapy. And I will be the first to tell you that many don't know. Like when you are on testosterone, you have to check the blood counts to make sure the red blood counts don't get too high. And it's important because one of the ways testosterone works is by increasing bone marrow release of red blood cells, which is great because it increases your muscular endurance, which is a good thing. But it can be overkill, and you can produce too many red blood cells, and we don't want too many red blood cells that actually cause sludging and potential stroke. So I always check blood counts when I check my hormone levels with my man on testosterone replacement therapy. And if I can't get it down, I might have him stop for a week or stop for 2 weeks out of a 6 month period. Hold it for a month, or hold it for a week. If that doesn't work, then they have to left. It's called a therapeutic phlebotomy. They go to a hospital or Red Cross so they can take out a unit of blood. And God knows we need blood these days. But that can be handled pretty easily. The other one is estrogen levels can rise. Now, testosterone and estrogen look very similar structurally, but they're remarkably different, right? So we always check estrogen levels, and if they are too high, we may have to reduce doses of testosterone or even give you an estrogen blocker. So uh, again, you don't know unless you check levels. I've had many people come to me after they've been to other longevity experts. They say they didn't check my estrogen level, they didn't check my blood counts, they didn't check my PSA. And PSA is very important to check. Now, it's never been shown conclusively that testosterone causes prostate cancer. Now, they thought that back in 1942, where Dr. Hudgens made this discovery that prostate cancer is linked to high testosterone levels. And he worked with castrated men, and they were studying a chemical called acid phosphatase, which is not even used anymore. Now, that was the spark that lit the fire. But we knew from that point on, wow, there's a link, prostate cancer and testosterone therapy. So, and he actually won the Nobel Prize like in the early 60s, 20 years after he made his discovery. And actually, he was able to receive notoriety for it. However, I'm happy to tell you that has since been borne out. Most of us do not think that there is a link between testosterone replacement therapy and prostate cancer, although a lot of people, the old school, still believes it's true. And that has been since been ruled out, which is very important. Now, it's a difference. If you have prostate cancer, can you take testosterone? And I would say most of us would definitely not do that because testosterone therapy, prostate cancer is a hormone-driven cancer, just like breast cancer and uterine cancer and ovarian cancer. So we don't want to feed it. So we wouldn't give you testosterone replacement therapy. Although I will tell you that that is a bit controversial, that it may not be such a detrimental thing. But at this point in time, there's a rare doctor that would be treating patients with prostate cancer with testosterone replacement therapy. Okay, the other one, my favorite, is testosterone and heart disease. Now, I've done at least 2 blogs on this. I've done a video on this in the past, and but the myth still, people still think there's a link. Well, I'm happy to tell you that a new study came out this week, the Traverse study, TRAVERSE, the Traverse study, published in June 2023. So who says we're not cutting edge over here? And they studied 5,000 men from the ages of 45 to 80, and they studied them for 22 months. Half got testosterone gel, half got placebo. They both had low levels, both groups had low levels of testosterone, and they were symptomatic. And the primary endpoint was cardiac events, heart attack or stroke. And they discovered that it was similar in both groups, that there was not an increase in any cardiac events in the group that was actually given testosterone. I hope this will eventually be laid to rest because this is like, I don't know how many studies I've reviewed over the years. But the only thing they did find was that there's a slight increase in arrhythmias, not life-threatening arrhythmias, but possibly atrial fibrillation or PVCs or things like that with the group that took testosterone, and maybe even a little kidney dysfunction. Although I will tell you, in the 23 years that I've been prescribing testosterone with so many men, I've never seen a decrease in kidney function nor any serious arrhythmias. So, but that was what they noticed in the study that just came out this past week. So that's really a lot now I'm going to be open for discussion. So I talked about a lot. So, I'm interested in what you have to say. So, guys, please give me your questions, and I'm here to answer them the best way I can. Okay. If not, I'll give you a few of my own. Um, there's something called, there's people were asking me about these things called SARMs, selective androgen receptor modulators. This is not testosterone. These are signaling molecules that can attach to the testosterone receptors and do what testosterone does. I don't really have experience in it. They're not really legal. They are sold on the internet, but there's no drug company that puts it out. And it isn't something that's well established. And they are not devoid of side effects. So I'm not personally using them. Now I'm seeing them being used in women, selective androgen receptor modulators. Why would you use something that blocks, so that now this being used inappropriately in women, and that bothers me to a great extent. But anyway, I'm not here to judge it. I'm just here that we have to be very careful taking the medications in women because they will develop masculinizing features. So it's not devoid of side effects. It may be less so than testosterone. But then again, I don't think testosterone has a lot of side effects. If you go to the right doctor who has experience in testosterone replacement therapy. Oh, good. I got a few questions. All right. I want to try the testosterone cream. Okay. Is there a difference between cream and the injections? Now, this study that I talked about, the Traverse study, did only gel. People like this gel. They think it's more physiologic. Um, I've been using testosterone therapy for many, many years. I have not found a difference. I will tell you that it's about 12% of men, or maybe even greater, that will not respond to topical therapy. I don't care what the dose is. It's not having to do with body hair. It's just they don't absorb it. So when you give an injection, you're bypassing one layer called skin, and so you're injecting directly into a muscle. I've never seen that not work. But have seen several, at least 12%, if not greater, of men not responding to topical testosterone. But they both work. It's the same parent compound, and I give the patients the options. I do the injections because it's once a week, and I do enough stuff topically. That's all I need is another project to do every day. But they both do work. Okay. Does testosterone reduce inflammation? That's a good question. It's a very good question. I don't know. One thing it can do, it can increase your insulin sensitivity, which we didn't talk about. But the question of diabetics and metabolic syndrome and pre-diabetics is really huge in this country. And I have definitely seen. I like to be able to put a male on testosterone. Because it may help with insulin sensitivity or combating the problem with insulin resistance. As far as inflammation, it's interesting. Now, I think it may. I don't know I mean, we know that estrogen can be anti-inflammatory. I think it may be very similar. But here's my thing, guys. Whether you're a male or female, and I am biased because I'm anti-aging, right? I'm into aging, ungracefully around it, right? Anyway, what I like to talk about is I think men and women look better, think more clearly, and feel better on hormone replacement therapy. We talked about women last month. In women, I think in men also, and I didn't talk about this, there are some positive effects on the heart. Now, we know with women, estrogen therapy can actually help the endothelium to increase with association with nitric oxide. And there's something very similar with testosterone with men. So it's not indicated for cardiac benefits, of course, but when I have a patient on testosterone replacement therapy as a male, I like to get their levels over 550. That's when you start to see cardiac benefits. And again, it's nitric oxide production happens in the endothelium itself, and you have vasodilatation or dilating of the artery, which enhances blood flow, which is a good thing. Let's see. Let me see. Managing the problem with thick blood. We talked about that. The important thing, you need to go to a doctor who checks this regularly. When I put a patient on testosterone, I follow them at least 2 months after they started it, and then 4 months after that. And then if the no changes need to be made, I'll generally I'll generally test them at least twice a year, and I insist that patients have blood work done and see me twice a year because hormones going to affect every aspect of your body, every tissue. So it's very important. So if I do that, I'm not gonna miss thick blood. I'm not gonna miss high estrogen levels. I'm not gonna miss a rising PSA. Okay, so I'm really on top of it, and it's really a modicum of blood work that you need. But I also will check lipids, chemistries, and things like that to make sure that the kidney function is not decreased. But I've never had that problem. I've never had diminished kidney function on the basis of testosterone itself. Um, Now, what if children are in my future? I get that question a lot. Well, then you're going to have to stop testosterone. Testosterone will definitely cut off sperm production as well as your native testosterone production because you're giving it exogenously. And the body says, well, I don't need it anymore. So I could just turn mine off. So it turns off its own testosterone and sperm levels will go down and sperm motility will be affected. Now, I haven't had that problem. If a man wants to get pregnant, I say, okay, stop it. X amount of weeks. We'll give you a combination of HCG and Clomid, which are two drugs that are well known for enhancing fertility. It's actually for women, but it's used off label for men. And sometimes I'll do one round back to back in men, and then I'll recheck their sperm count and their sperm motility so I can get most men fertile again, even if they've been on testosterone for a while. Um, we talked about, let me see, any other questions here? No questions tonight, guys. Let me see. Um, I don't see any other questions. So it must have been, okay. All right. Well, I guess I talked enough. So if we have enough further questions, we'll just sign off now. I will be giving a presentation in August. I have a topic in mind. It'll be a very personal topic, and I'm going to surprise you guys with it next month, probably around the mid part of the month. So anyway, I thank you for joining me tonight. I'm very grateful, and please share this with other people. Even though this was done live, it will remain a permanent part of my YouTube library, so anyone can access it. But please subscribe to my YouTube channel; it does help, and please give me a thumbs up or like the program you're watching. It also really helps. I'm very grateful, and oh, I always like to plug in my book, From Both Sides of the Table, When Doctor Becomes Patient. It's my story, but it's much more than my story. It's how you can become your own medical advocate by taking charge of your health, by pulling in the reins. It's doable. All right, guys, thank you very much. Have a wonderful rest of the week, and I'll see you in a few weeks. Thank you so much. Appreciate it. Have a good night.